I'm Dr. Peter Vila, and I'm a facial plastic surgeon. And in this video, we're going to talk about rhinoplasty. There are a lot of things to know about a rhinoplasty, and a lot of those details are things that we will talk about during the consultation. And so what I'm going to do is show you a couple of examples where I'll go through and discuss a little bit about what we did. All of these results are from a surgery that took me about 3 to 4 hours to do, and then it takes about a couple of weeks of swelling where it will look like you just had surgery, and then it's really closer to 3 to 4 months, even out all the way out to a year for things to look completely healed. At the 1 month mark, you're looking pretty good, but it's really 3 to 4 months, even out to a year for people with thicker skin, and just to really see all the definition that a lot of people tend to want to see. So let's go through some of those examples. In this example, what I did is basically just took down the bump. Now, when I say just, it is anything but straightforward. It looks straightforward. It's like, oh, you can see this result and you can say, yeah, that's great. Now her bump's gone. She's happy about it. Yes, but that is a fairly complex thing to do. A rhinoplasty is a very challenging surgery, and there are lots of maneuvers that I have to do to achieve these results. However, the outcome is that it just looks like we just made the bump go away like on Photoshop, which is awesome. Sometimes I do work on the tip, and so understand that the bony part of your nose, this part, and the tip, the cartilage, are two different things, and we're going to address them differently. And so when I do work on the tip, usually I'm doing both when I'm doing a rhinoplasty, but in some cases I will only work on the tip cartilage. And so what I'm doing is reshaping those cartilages to get the shape that we're looking for that gives us the aesthetic result that we want. And this is a good example. This patient actually had some trauma to her nose. She's not quite sure why her nose ended up looking like this, but progressively it got more and more twisted. And so what I did is basically do surgery to make it look more natural. And so that's kind of a theme that you'll see over and over again, especially with my results, where I'm really just trying to get things to look natural and like you were born that way. So what you can see here is that before the tip is super twisted, and after, it just looks like a normal nose. Like you wouldn't notice this nose if you were talking to her. You would notice her face, her eyes, other things. You might notice her hair color, etc. But you're not going to be able to place the fact that like, oh yeah, now her nose just looks normal because now it blends in. And that's always the goal, is to get the nose to just blend in with the face. It shouldn't distract people. And then finally, here's another result where both the bump was the issue and the tip was the issue. And so this was a very crooked nose. And so it's important to understand that all of us, 100% of us, are asymmetric in some way. And so in some people, it's really noticeable. In others, it's not so noticeable. And so for this particular patient, she was really bothered by the asymmetry of her nose. Now, what I did is a full-on rhinoplasty in the operating room where we got the nose straighter. Now, I hesitate to use the term straighten because getting the nose perfectly straight is extremely difficult. And so getting the nose much straighter is always the goal. And when you look at this photo, you can see she looks much straighter afterwards. Is it perfectly straight? No, but it is definitely a lot straighter to the point where now it's not distracting to her or to other people talking to her. Then if you look at the tip from the side view, you can see that she had a bit of a what we call a pollybeak, where it's a little full up here above the tip. You really want this part of the tip to be the part that comes out the most. That's what looks the best aesthetically. And so that's what we did for her. And you can see when she smiles, it still stays up and looks good. So these are all my patients. These are all real surgical results. And I am super excited for them and the fact that they get to enjoy this basically for the rest of their lives. If you'd like to talk to me about your nose, I would love to talk to you. We do in-person visits, we do virtual visits, and even if you're coming in from out of town, I'll have you come in a few days before so that I can actually examine your nose before we go off to surgery, but we can certainly start that process virtually. You know how to find me. Take a look at my videos. I'm Dr. Peter Vila. You're beautiful, and I will see you on the next video.